Assalamu alaikum. My name is Mahbano and I am going to present the examination of cranial nerves. Basically, there are 12 cranial. Their functions are usually categorized as being either sensory or motor. Sensory nerves are involved with your senses such as smell, hearing, and touch. Motor nerve control the movement and function of muscle or glands. The name of first cranial nerve is olfactory and its function is sensation of smell. Second one is optic, which function as vision, as for the vision. The third one is oculomotor. Its function is as motor, and it supply extraocular muscle except superior oblique and lateral rectus. Then the fourth one is trochlear, which supplies to superior oblique. Fifth one is trigeminal, which function both as motor and sensory. Sixth one is abducent, which functions as motor. Then seventh one is facial nerve, which function both as motor and sensory. Then eighth is vestibulocochlear, which works for hearing and balance. Then the ninth one is glossopharyngeal, which work both as sensory and motor. Then tenth one is vagus nerve, which work as parasympathetic supply to thorax and abdomen. Then 11th is accessory, which function as a motor. Then 12th one is hypoglossal. Now, coming to the examination of olfactory nerve examination, test each nostril separately. Ask the patient to close the eye and one nostril. Present with common smell like clove, oil, peppermint, soap, and ask him to identify each. Don't use irritating smell like ammonia. In normal condition, if patient can smell or identify smell with both nostrils, olfactory nerve is intact. Usually there are three interpretations: anosmia, parasomnia, and hypothermia. In anosmia, there is loss of sensation of smell due to any head injury, tumor of anterior cranial fossa, or tuberculosis, meningitis. In parasomnia, there is perfusion of smell. Offensive smell is perceived as pleasant smell, sometimes psychogenic. In hyposmia, there is diminished sense of smell, which means the patient can't feel any smell. Now, for examination of optic cranial nerve, we do a visual acuity test. We will test each eye separately for near and far vision. Near vision tested by asking a patient to read book or newspaper at a distance of 10 inches. For vision, we done a test which will known as Snellen's test. Then Then we will run three tests: colored vision, field of vision, and fundoscopy. For this, for colored vision, we will use a chart to test patient by asking him to recognize various color. Then for field of vision, the patient this is tested by perimetry or by confrontation method. Both binocular and uniocular field of vision will be checked. Then in fundoscopy, the retina can be used with the help of ophthalmoscope. Then there are two interpretations for optic nerve examination, which are hypomnia and quadrantnomia. In hypomnia, loss of vision affecting one half of the visual field. Then quadrantopia, in which there is loss of one quadrant of visual field. अब ओक्यूलोमोटर ट्रोक्लियर और एब्ड्यूसेंट नर्व की एग्जामिनेशन, इनके लिए जो एग्जामिनेशन होती है ओक्यूलोमोटर के लिए, उसमें हम एग्जामिन करते हैं प्रोसेस को, प्यूपिल को, लाइट रिफ्लेक्स को, एकोमोडेशन रिफ्लेक्स को. उसके बाद जो ट्रोक्लियर की एग्जामिनेशन होती है उसमें हम टेस्ट करते हैं सुपीरियर ऑब्लिक मसल को, जिसमें हम पेशेंट को बोलेंगे कि वो हमारी फिंगर जो है वो मिडली और डाउनवर्ड जब वो मूव करे तो वो उस फिंगर को फॉलो करे। उसके बाद जो एग्जामिनेशन होगी अब्ड्यूसेंट की, उसमें हम पेशेंट को बोलेंगे, उसमें हम टेस्ट करते हैं बेसिकली लेटरल रेक्टस मसल को, जिसमें हम पेशेंट को बोलेंगे कि वो जो हम फिंगर मूव करवा रहे हैं लेटरली उस फिंगर को फॉलो करे। उसके बाद ट्राइजेमिनल नर्व की एग्जामिनेशन, इसकी एग्जामिनेशन में हम दोनों फंक्शंस देखते हैं, सेंसरी की भी एग्जामिनेशन होगी और मोटर की भी। जो होती है ना एग्जामिनेशन ऑफ मोटर फंक्शन, इसमें हम लोग क्या चेक करते हैं, जॉ जर्क रिफ्लेक्स को हम चेक करते हैं। इसमें हम पेशेंट को बोलते हैं कि माउथ को ओपन करें और एंड हैंग द जॉ लूजली। फिर हम थंब को प्लेस करते हैं ओवर द चिन एंड स्ट्राइक इट विद हैमर। अगर जॉ क्लोज हो जाएगा तो फिर ये शो करेगा कि रिफ्लेक्स प्रेजेंट है हमारा जो है ना उसमें पेशेंट के उसमें जॉ में रिफ्लेक्स प्रेजेंट है और इट इज़ रिस्क इन पैरालिसिस ऑफ फिफ्थ नर्व। देन एग्जामिनेशन ऑफ सेंसरी फंक्शन, इसमें हमारे पास सेंसरी फंक्शन में हम कॉर्नियल और कंजक्टाइवल रिफ्लेक्स देखते हैं। इसमें पेशेंट को हम कहते हैं कि वो मीडियली देखे और उसके बाद टच द कॉर्निया एंड कंजक्टिवा विद द wisp of cotton from lateral side. The loss of corneal reflex shows paralysis of fifth cranial nerve. Here are some interpretations for trigeminal nerve, जिसमें हमारे पास आ जाएगा ट्राइजेमिनल न्यूरोलजिया, सेरिब्रोपोटाइन एंगल ट्यूमर, कावर्नस साइनस लेयन और बायलेटरल मोटर पैरालिसिस। अब फेशियल नर्व एग्जामिनेशन, इसमें हम एग्जामिन करते हैं मोटर फंक्शन को, जिसके लिए हम इंस्पेक्ट करते हैं फेशियल ड्रॉप और एसिमेट्री को। मसल ऑफ फेशियल एक्सप्रेशन, आस्क द पेशेंट टू लुक अप एंड wrinkle his forehead, examine wrinkling loss and feel muscle strength. Then ask the patient to shut eyes tightly, compare both sides. Then ask the patient to grin, compare nasolabial grooves. Then ask the patient to frown, show teeth and puff out cheeks. Then examination of taste and secretomotor function. Taste of tongue can be tested by giving patient different solutions of salty, sweet, sour, or bitter taste. Put the drop of each solution one by one and ask for response. Lacrimation and salivation can be tested by different methods. There are some interpretations of facial nerve examination, which includes Bell's palsy, upper motor neuron Leyen-Bell's palsy, lower motor neuron Leyen-Bell's palsy. For examination of vestibulocochlear nerve, we will examine cochlear part. For hearing test, we will done Rain's test and Weber's test. Nerve deafness cannot be detected by Rain's test. In Weber's test, we will confirm the deafness which is detected by Rain's test, and for which we will use a vibrating tuning fork which is kept on vertex, and patient is asked on which side he hears better. Normally he should hear equal on both sides. If it is better on right side, it means conductive deafness is on right side or nerve deafness is on opposite side. All tests are done with tuning fork having frequency 256 and 512. Because our ear is maximum sensitive for these frequencies. Then vestibular part is examined. Observe patient equilibrium as patient stands or walk. Observe normal eye movement. Ask for dizziness, falling, nausea and vomiting. The interpretations for vestibulocochlear nerve include middle ear deafness. The note is not heard. Nerve deafness, air and bone conduction is reduced, but air conduction remains better. Then we will examine the glossopharyngeal nerve, and in this we will examine the sensory and motor both functions. In sensory function, gags reflex. I ask the patient to open mouth and depress his tongue with spatula. Touch the posterior pharyngeal wall with cotton stick. There will be elevation and contraction of wall on that side. Then plateral reflex, when soft palate is touched, it moves upward. Each side is tested separately. Then in motor function, it cannot be tested independent of 10th cranial nerve, which is vagus nerve. Then for the examination of vagus nerve, only motor function is tested, which include speech, soft palate, posterior phalangeal wall, vocal cords. The interpretations of vagus nerve include bilateral vagus nerve palsy, laryngeal nerve damage during thyroid surgery. Then examination of accessory nerve, testing SCM of both sides, patient bending his head downward, testing trapezius muscle of trapezius of both sides, patient shrugging his shoulder. The interpretations of accessory nerve include accessory nerve is paralyzed along with other nerves in bulbar palsy. Then examination of hypoglossal nerve. Motor supply to muscle of tongue is tested. Test the protrusion of tongue. Ask the patient to open mouth and inspect the tongue for size, shape, and wasting. Ask the patient to press against cheek wall while applying pressure on the side of the cheek. The interpretations of hypoglossal nerve include bilateral, UMNL, tongue look, smell, corneal, and immobile. Then unilateral UMNL, tongue deviated to paralyzed side when protruded. Thank you.